Hello, and thank you for tuning in today. I'm your host, Neal Howard, here on Health Professional Radio. Our guest says that for the first time in 200 years, our kids are not expected to live as long as we do. And she further adds that the reason for that is that our American medical system is based on the prevention of death rather than the prevention of disease. Dr. Mylaine Riobe, thanks so much for joining us today, Doctor. Thank you for having me, Neal. It's great to be here. You are an integrative healthcare professional. You are a certified physician as well as an alternative medicine practitioner. That's correct. I'm a board certified gynecologist with 16 years of experience, and I just recently took my integrative medicine boards because that was just recently recognized by the American Board of Medical Specialties. So hopefully I'll be double board certified soon. Great. Congratulations. Thank you. Where exactly are you practicing now? I'm in South Florida, Stuart, Florida. Okay, so you've recently got your certification in integrative medicine. You were a traditional gynecologist before that, and in addition to that now. What was it that got you interested in alternative or integrative medicine? Is this something that you've always been interested in? Well, I had little inklings of it as even a child. We're from the Caribbean, my family, and so, you know, my grandmothers were always in the backyard growing herbs and talking about potions and different things. And so I was exposed to that as a child. And on the other side, the male relatives in my family, my dad is a dentist, and so he was more in the traditional medical community, if you will. So I had a little bit of both. And being in the United States, I naturally gravitated towards, our conventional medical system as I got older. And, went to school, went through all the traditional channels, and I was promised I'd be able to help people and do a bunch of things. And when I got out, I quickly realized that was simply not the case. And that most people are not running around with an acute life-threatening condition that our conventional medical system treats very well. They're running around with chronic nuisance symptoms. So my patients started coming to me in droves complaining of fatigue and weight gain and depression and, symptoms that were not life-threatening but life-altering. Absolutely. And our conventional medical system had nothing for them. And so I became very rapidly frustrated as soon as I went into private practice. And I didn't last even 4 years after residency in a conventional setting. And I went to study traditional Chinese medicine. It took me about 5 years to really grasp it completely because the system here in the United States is taught differently than it is in China. But I did a 2-year internship with my mentors down in South Florida, and for the past 8 years, I have been at the Riobe Institute of Integrative Medicine, where I integrate traditional Chinese medicine and also functional medicine, which is a more modern holistic system, into my existing practice, and that has really been a game changer in terms of preventing diseases and helping people to feel well and to identify causes of what may become life-threatening conditions down the road so that we can thwart them. Now, in addition to a medical practitioner, you're also an author. Talk about why you wrote the Tao of Integrative Medicine and also the answer to cancer. Yes. Well, the Tao of Integrative Medicine came about because I wanted people to know why what I do works better than what we've been taught we should do. Our conventional system, again, is excellent if you're having an acute heart attack. It's excellent if you have acute appendicitis, but it's not valuable for less acute conditions. And what's happening is we're leading people down a spectrum that leads them right into diseases with our current system of medicine. Our system of medicine is being overutilized and overapplied for conditions that it doesn't successfully treat, and it's actually beginning to cause diseases rather than successfully treat them. And so I wanted to give people a more fundamental way that actually works better so that they can make informed decisions about their own health moving forward. And so it helps to explain why Chinese medicine works and why functional medicine works for the conditions that we're faced with today that our conventional system doesn't work for, and how we can utilize all three very successfully.
Your book, The Answer to Cancer, that's a big one because cancer is the biggest subsection of the medical industry. It's absolutely huge. It's like this massive creature that's absorbing all aspects of medicine. You talk about not only dealing with, but preventing cancer in the first place at its root. Yeah. In your opinion and in your experience, what is the answer to cancer?
The answer to cancer is looking at the metabolic conditions that develop under stress. Mm-hmm. And so the definition of stress is anything that imbalances the body. And when we look at the 21st century and the unprecedented toxins that we're dealing with, and our children before they're born are exposed to 180 different cancer-causing toxins. So before they're even outside of their mother's womb, they've been exposed to toxins that cause cancer. And of course, children are very vulnerable as they're developing. And so when they're born, they're having to deal with all these toxins all day long, and the systems that they are needing to develop don't develop properly. And that's why we're seeing a lot of childhood cancer, and that's also, in my opinion, why we're seeing this epidemic of autism as well. And so as adults, we're also facing the same crisis where our food is toxic, the air we breathe is toxic, our cleaning products are toxic. So that's a stress to the body. And what happens is, although we can't see it, when we look up at the sky, it's still blue, the water is still clear. When we analyze it, it's toxic, and we see many, many chemicals, thousands of chemicals, 200 of which are known to cause cancer. And so this is going into the body each and every day. And so inside our cells are so small, they're invisible to us, and yet there are, billions of chemical reactions going on, if not trillions, every day in each and every cell. Those toxins that we can't see are huge to our cells. And so they get lodged and wedged into the mechanism of our cells, and our cells are where all of our body function originates. So our immune system originates from within our immune cells. Our normal genetic code is duplicated within our cells. So if those cells are not healthy and they're constantly dealing with toxins, we're going to get genetic mutations. Our immune system will become weak. And when we develop a cancer cell, our body will then be defenseless against that cancer cell. And that cell will just stick around for years and years and years and very slowly duplicate into a mass that we will later diagnose, maybe 7 to 10 years later, as a cancer on a mammogram or a colonoscopy. So when you can get into that cell and identify what's wrong with that cell at the very early stages, the early stages are when you start to feel tired. That's the number one symptom that starts the cascade. That's because your metabolism is now slowing down. So as soon as you start feeling tired, that's the first hint that something's wrong with your metabolism. In other words, something's wrong with your cell function. And that's where you want to go and get evaluated to see, why am I tired? What's happening in my cells? Do I have vitamin deficiencies because of all these toxins? Because the body has to work harder to get rid of the toxins. So that means it's going to blow through more resources to get the job done. So that means you may have higher vitamin demands than you otherwise would. It may mean you need more detoxification support than you otherwise would. It may mean a lot of different things. And so you want to get your cells analyzed, which is what we can do in Chinese medicine and in functional medicine, to see where am I going wrong so that I can correct these things so that I don't feel fatigued, because now I've treated the cause of my fatigue. And so in doing so, you actually prevent diseases such as cancer.
So would you say that that is, in a nutshell, the Riobe Method?
That is the Riobe Method, yes. We evaluate people from an energy-based perspective as well as from a cellular-based perspective. Because what we're finding out is inside of our cells is mostly energy. It's mostly empty space. And there's a lot of what we would call today quantum physics going on inside of our cells. And it's not the conventional medicine that we think it is. And so if we can apply an energy-based system and a functional-based system to that cell and begin to correct the metabolic dysfunctions, that will keep us a lot healthier, get rid of those toxins that will inevitably get into the body. We can escort them right out very quickly if the body is capable.
Now, earlier in our conversation, you mentioned children. Does either of your books discuss how we as adults can begin to change our view of healthcare and then transmit that down to our kids, because they are, as you say, more susceptible? And the story that you tell about how these toxins are affecting the cells, how they're so huge, it's a horror story, because it seems, being smart humans, a little bit deliberate. It seems a little bit deliberate. That's just my take on it, and the views expressed here, of course, the disclaimer, right? But that's just my take on it. And as the other diseases, I guess it's the same process, because not only are these cancer causing toxins, but they cause all sorts of other diseases. And most of these diseases, if left untreated through conventional medicine, will morph into cancer. That's the weirdest thing to me. Now, you've written these 2 books. What type of feedback do you get from people who have entrusted their entire lives to traditional medicine, a medicine that you have an intimate knowledge of, being a practitioner, and now having something better?
Well, at first it's anger. Why didn't my doctor tell me this? Why don't other doctors do what you do? And the answer is we're not trained to do that. You have to really be thinking outside the box. And for a physician today to even have time to breathe is extraordinary because of all the pressure that is on the medical industry. Doctors today are so busy in regulatory systems and being glorified secretaries, basically, that they no longer have time to practice medicine or do any outside research. So if you're not actively looking for another method, you'll never find it. And we know all of this stuff because we learned it in medical school. That's the irony. So we learned a lot about functional medicine in medical school because we all learned physiology. And functional medicine is nothing but the restoration of physiology. The problem is we went to residency. And when we got to residency, we got a whole different kind of training that emphasized looking for diseases to treat them. And that's where we went wrong. We should have been looking for the causes of diseases to treat those, not the diseases themselves. So it's a perspective problem. And so, we try and explain, our conventional medicine works great if you have appendicitis and you're having a heart attack. But now once your life has been saved by that system, we have to ask another question, is what led you to that path? And how do we get you further away from the cliff so that you don't just keep going over the cliff with another condition and another condition because we never looked at your root causes. So that's how we tie it together. So then what I try to do is educate my patients so that they have an understanding of why our conventional system is not obsolete. It's still very, very important. But to give them this idea that about 90%, if not 95% of the care that we obtain should be holistic and not conventional. Our holistic system should be our primary care.
Absolutely.
And then now if you break through, we can't prevent everything. So if you do have an appendicitis or God forbid you get diagnosed with cancer or you have a heart attack, we have our conventional methods that we can also apply for a short period of time, again, to make sure that we save your life because that's what that system does. And then we continue to work to try and reverse causes. So that we tend to get, from anger to understanding, hopefully, and then we can help them maneuver through all 3 systems.
Now, where can we go online and get some more information about your practice and integrative medicine in general?
Yes, if you go to RiobeIntegrativeMedicine.com, you'll find our website there. And we have lots of informative videos and newsletter. You can also purchase the 2 books, The Tao of Integrative Medicine and The Answer to Cancer there.
Pleasure speaking with you today. Thanks for coming.
Thank you, Neal. It's been wonderful to be here. Great. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Mylaine Riobe, an integrative practitioner in Florida here in the United States. And we've been talking about her approach to holistic medicine. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and see us on YouTube as well.